a sign that you have joined. Okay, thank you. I use this opportunity to welcome you all here. I see Judith, Kilae, I see Renatus, I see Kabembo, I see Nikutusia. So I use this opportunity to remind you all, to remind others to join the session, because the time is now. Pia tutatumia lugha zote mbili, lakini hasa tutatumia Kiingereza kwa sababu tutakuwa na wenzetu kutoka Kenya ambao wanajua Kiswahili lakini wanajua na kutumia Kiingereza kwa kiwango kikubwa. Kwa hiyo tutatumia lugha zote mbili. Participation profile inatuonyesha kwamba watu mbalimbali wamejiunga na session hii, na tunatambua uwepo wao na tunasisitiza matumizi ya lugha zote mbili ili wote waweze kutuelewa. Lakini pia tunasisitiza matumizi ya lugha sahihi. System yetu moja kwa moja ina record sauti, ita record video, lakini pia maoni ambayo watu watayaandika. Niwakaribishe sana. Huku presenter wetu akijiandaa, basi kwa muda huu mchache tutumie kuwakumbusha wenzetu waweze kushare link na kujoin ili tuweze kuanza wote pamoja. Asante sana, nitarudia muda si mrefu tena. Hello, I'm back here, and it's my pleasure to warmly welcome each and everyone for today's session. Thank you for taking the time out of your busy schedules to join us. Your presence here reflects a shared commitment to learning, personal growth, and the collective well-being. So we are especially grateful to have participants from various areas, from different hospitals, and those who are working outside their hospital setting, those who are in country, those from Zanzibar, from Kenya. I see from the attendance that is registered, where we welcome you all. And all we are connected through this virtual platform. This gathering is a reminder that distance does not limit our ability to learn, support one another, and grow as a community. On behalf of the organizing team, I extend our sincere appreciation for your interest and participation. We hope this session will be engaging, interactive, and enriching for all of you. So, welcome. Mr. President, if you're hearing me, I want to hear something. I want to hear a word from you. Then I'll be back on a technical issue and helping those who are facing joining challenge. Welcome, Mr. President, from Mobile Facilitation Team.
Okay, good evening, all of us.
Good evening.
So thank you very much for this chance. My name is Moses Evaristo, President of Mobile Facilitation Team. So as I've been introduced by the conference manager, I'll be taking you through some of the introductions that will allow us to continue with our session. Actually, before starting our introductions, I would like to take a chance to hear the greetings from our presenter and moderator of today. So we have Mr. Kilai Kalino from Kilimanjaro, who will be moderating our session today. If you are here, just say hi to us.
Hello, hello.
Okay, you are most welcome, Senior.
Thank you so much, Moses.
Thank you very much. And also we have the facilitator from Moi Teaching and Referral Hospital, Moi, Kenya, Mr. Nicholas B. If you are here with us this time around, can we hear something from you? Hello, Mr. Nicholas. Okay, please, can you unmute your mic and then greet us even by saying hi?
All right. Good evening and glad to be here.
Thank you.
Welcome.
You are most welcome, Chief. Okay, so I'll be taking you to introductions, and there will be very few issues to display here before allowing the presenter to start the presentations of this evening. So I'm starting to introduce the presenter and moderator. Please and kindly continue sharing the link so others can join, because the sessions are going to start right now. So you will say to me if you see the slides that I'm going to display here. Okay, so can you see the slides?
Yes, we can see.
Okay, thank you very much. So dear healthcare professionals, ladies and gentlemen, good evening once again. So we welcome today online sessions on resilience and well-being. So it is an honor to gather here through Mofate platform as a space dedicated to empowering professionals through shared knowledge, capacity building, and also continuous learning. In a world marked by the rapid change, unexpected challenges, and the growing demands on our personal and professional lives, resilience is more than a concept. It is a daily practice that allows us to adapt, recover, and grow stronger in the face of adversity. So likewise, well-being is the foundations of thriving mental, emotional, and social, both as individuals and within our communities. So today we come together not only to understand these two powerful themes, that is resilience and also well-being, but also explores how they intersect in our everyday lives. So how resilience enhances our well-being and how prioritizing well-being strengthens our capacity to overcome challenges with purpose and positivity. So as we begin, I encourage each of you to engage openly, reflect deeply, and consider how the insights shared today can support your own journey towards stronger resilience and sustainable well-being. So as we have been introducing and also posting our posters, so our sessions is actually categorized into mental health. So it is a mental class, and it is a resilience and well-being as we have been introducing ourselves. For those who have been registered professionals, so you are going to acquire the CPD points from these sessions at the end of the session. There will be 2 CPD points because we are going to have 2 actively hours. So our sessions will be actually facilitated by 2 young professionals with invested in mental health. Actually, Mr. Nicholas from Kenya and also Kilai Kalino from Kilimanjaro KSMC. So moreover, you'll see them and you'll know them a little bit. So some of the areas that we are going so much to cover ourselves within our discussions today, actually we are going to address the major stresses, workload, trauma exposure, and limited resources. And also we are going to see how we are going to share practical self-care and resilience building strategies. And also we are going to outstand on the issue of emphasis, supportive leadership and safe working environments, because this is more useful for workers. And also we are going to reflect on the emphasis, supportive leadership and also safe environments as it have been repeated again. So we have some of the statements that have been revealing the realities about resilience and well-being. So far, we are going to hear much on those who joined here. So this one will be the timetable. Actually, we have two important areas, the part of presentations, the part of floor discussions, where all of us, we are going to engage much on this, and also we are going to have the Q&A sessions, and also the way forward as healthcare professionals, what do we think, and how are we going to tackle the issues concerning with the resilience and well-being. So let us now know some issues concerning, or a little bit about the moderator of today. So he is Kilai Kalino, is a mental health and health policy strategist, an implementation science fellow at the Harvard Chan School of Public Health, and also assistant lecturer at KSMC University in Kilimanjaro, Tanzania currently. So he teaches and mentors undergraduate students in classroom and clinical settings, also contributes to curriculum development and supports applied research in mental health and health system. He works at the intersections of mental health services, workforce well-being, and also policy-driven implementations. So translating evidence into practical, scalable solutions across healthcare, education, tourism, and the community sectors. Moreover, his impact includes providing mental health support to healthcare professionals, tourism industry teams, families, and the schools also, with a focus on reducing burnout, strengthening psychological safety, and also sustaining performance in high-pressure environments. So he has led resilience building and workforce well-being initiatives aligned with the institution priorities and also services delivery realities. So Kilai is a founder of the Career Architecture Institute and the creator of Beyond the Bedside, a platform that supports healthcare professionals in transitioning into sustainable purpose-driven careers in leadership, policy, innovations, and entrepreneurship. Moreover, on Kilai Kalino, his work focuses on strengthening mental health system, workforce resilience, implementation, science of real-world impact, and sustainable career design for healthcare professionals. So this is all about the Kilai Kalino, the biography that we have been highlighted and cited from the realities of what we have been going to do this time around. And the final one, we have a facilitator of today. Actually, he is Nicholas KB from Moi in Kenya. So he's a registered psychiatric and mental health nurse at Moi Teaching and Referral Hospital in Kenya, where he delivers specialized patient-centered mental health care in a tertiary hospital setting. His practice emphasizes evidence-based interventions and holistic management of psychiatric conditions. He holds a Bachelor of Science in Nursing from Moi University, which laid a solid foundation in general nursing practice, professional ethics, and clinical leadership. Building on this background, he earned a Master of Science in Psychiatric and Mental Health Nursing from Alexandra University, equipping him with advanced competencies in mental health, assessment, therapeutic interventions, and the management of complex psychiatric conditions across the diverse populations. So in addition to his clinical responsibilities, Nicholas actively engaged in mental health research, contributing to the generation and applications of the knowledge aimed at improving psychiatric nursing practice and mental health services delivery. His academic training and practical experience enable him to integrate research findings into everyday clinical care, supporting quality improvement and evidence-informed decisions making. Also, Nicholas also plays a significant leadership role within the nursing profession as the branch vice chairperson of National Nurses Association of Kenya. So in this capacity, he advocates for the professional development and welfare of nurses, supporting policy dialogue and promotes excellence in nursing practice. Through his combined contributions to clinical services, research, and professional leadership, he continues to mark a meaningful impact on mental health nursing in Kenya. So this one is Kilai Kalino, who will be moderating our session today, and the last one is Nicholas B, who will be facilitating the session today. So these are all about the issues that will be just going on here on our board. So taking a chance now to welcome Mr. Kilai Kalino as a moderator of today. So I'll be taking the board to continue moderating and allowing the presenter now to start the presentation. So back to you, Kilai Kalino and Kilas Joachim. The floor is yours and you're welcome for the session.
Thank you very much. Straight to Kalino. You may proceed.
Hello. Thank you so much, Brother Moses and Joaquin, for a nice introduction about what we are going to do today, this evening. And we really appreciate the incredible job done by Mofate. And we all now get to know that Mofate is a mobile platform that empower health professionals to share knowledge, capacity building, and continuous learning. And this is now a very important platform that breaks barriers to learning, that we can learn and share experiences across the world. So I have given the task to moderate this session this evening, and I don't have much to talk, but rather to welcome my colleagues, Nicholas, who will be taking us through the session, which is talking about resilience and well-being for healthcare professionals. And this is a very important point for us to listen and share experiences as we all work in high stressful environments with multidimensional, multifactorial issues that can lead to burnout, depression, and other psychological issues, with long hours working, multiple roles, and limited psychosocial support, especially in the workplace. We engage in a very stressful and exhaustion situation when we work with patients and different healthcare systems. So I'll be taking this opportunity to welcome my brother Nicholas to take us through the next part for 30 minutes, and then we'll follow with discussion. So, brother Nicholas, the floor is yours.
Thank you, Brother Kilai and the Mofate team, the president and the organizer and the rest of the team. I'm glad to be here once again. And as an introduction, we have a paradox in life that the roses we are seeing also have thorns, but they also have buds. In life, we have positive happenings, great things happening. We also have greater things to look forward to. But amidst this, we still have stressful events. We still have challenges. And that is life, not just for health workers, but for all of us. Tonight, our focus will be on resilience and well-being. But in the midst of resilience and well-being, we have to also see what are the stressors, what are these things that are challenging us, what are these stressful events that we are going through, and how are we responding to them? Because to be stressed, we shall be stressed. The most important thing is not when you will be stressed, not if you will be stressed, but when you will be stressed. How will you respond to that stress or the stressors in life? My name is Nicholas B, as introduced earlier, and I'm glad again to be here with all of us. And for those of us who are swimmers or who are learning to swim, there is this common mantra that you don't learn to swim when you are drowning. And just the same way resilience is, we don't need to learn resilience when you're already stressed up. The best time to learn resilience is when you're not yet in that crisis. So this is why we are here, to boost and to help us learn those strategies that we can build our resilience. Because as we have said, life has both challenges and stresses, as well as great things and greater things to look forward to. But that comes with thorns. So if you want to swim well, then you need to learn how to swim before you get into a storm or before you get into a drowning incident. Healthcare workers, as explained by our moderator and even our president, we face numerous challenges. We face numerous stressors. We have many thorns. Although some of us, we were dreaming to be the best healthcare providers that we can be, to have the best salary, you know, and to have the best everything. In those best dreams, we still have to face some demands. We still have to face some taxing roles, which are taxing us emotionally. And as they do this, they affect our mental health and job satisfaction. So our challenges as healthcare workers are endless. Recently, we had a global crisis through the COVID-19 pandemic. That was a real test on how resilient our healthcare system is, on how resilient our healthcare workers were. And to the surprise of many, most of our countries, especially in Africa, we were able to navigate through these challenges in a way that many people were surprised. And this is because of resilience that we experience right from individual level and even to the systems that we have in our countries, despite the poverty levels and all those other challenges in third world countries or developing countries. We were able to navigate through this. So the patient suffering that we experience, the ethical dilemmas that we face every day, those moral distresses that we have to decide, the compassion fatigue that we also experience, all these are major stressors, all these are major challenges that we have. That includes the working hours. We have long working hours. In my country, we have as high as 13 hours or 14 hours, especially when you're doing night. In other instances, nurses or medical personnel, healthcare workers working in critical care units, those working in emergency department, those even working in psychiatry and many other areas, including oncology. Those areas are emotionally taxing. As such, we need to see how to protect our mental health through resilience and well-being. So what is the risk if we don't have resilience and well-being? The risk is we'll have burnout, we'll have combustion fatigue, we'll have reduced overall well-being, we'll also have reduced job satisfaction, we'll have reduced productivity, and many other challenges that come with a lack of resilience. But if we have resilience, we shall be equipped with the skills to cope effectively. We shall also be equipped to deliver high quality patient care. And as such, we'll also have a good life or experience the dream that we want to experience even as we pursue our dreams as healthcare workers. So resilience and stress, these are Siamese twins, if I were to call this, because if you have stress, you need resilience to overcome. If you don't have resilience, you're likely to be crushed. There's a quote in the Holy Book that we are pressed from all directions, but we are not crushed. Why? It's because we are able to adapt, we are flexible, and we can be in a position to come back. That leads us to what is this resilience you're talking about? In other concepts, we can call it psychological immune system. If you have the best immune system, physical immune system, you can easily fight off diseases. You can catch some cough or flu, but you can easily recover from that. Unlike somebody who has low immune system or impaired immune system, that way they can take long to recover. But those who have the best or good system, immune system, they can bounce back to recovery immediately. So we face adversity, we face trauma, we face tragedies, we also face threats and stresses. But in all this, if you are able to adapt to those adversities or traumas and threats in your family work, in your family relationship, in your workplace relationship, or even in financial issues, then we can call you a resilient person. So in this context of healthcare workers, the resilience will encompass the ability to maintain emotional well-being and functionality despite the challenges that we are facing, which are inherent to this profession. The professions that deal with people, they are highly strenuous. They are also bound to have many stressors that will hit us here and there. Just like you can see that tree bending in the storm, it's bending so that it can't break, but so as to survive. Also, as healthcare workers, we have many storms that we need to withstand. We have many winds that are strong, that if we don't develop resilience, we can easily be carried away. So how about well-being? Well-being, on the other side, is a positive state in which we flourish. So we don't just need to survive, we need to flourish, we need to thrive. And if you combine resilience and well-being, that helps you to have a fulfilled or a satisfied or a satisfaction with life. It is the individual's evaluation of their current and past experiences that includes emotions, life satisfaction, and achievements that in areas of marriage, work, and other areas of our day-to-day lives. And we will delve into a short exercise, and I will ask us to do something, maybe for the start, before we move to the next slide. Resilience has key aspects that we will be referring to in one way or another. Aspect number one, or element number one, is adaptability, the ability to adapt to change. Aspect number two is coping. Are we able to deal with whatever comes on our way? Number three is about humor, whether you can find humor in the problems or the stresses that we're going through. Fourthly, we have growth from stress. Does stress strengthen you or it breaks you? Bouncing back. Are you able to bounce back after a hardship? Persistence. Are you able to achieve your goals despite the obstacles or despite those stresses? Focus. Under pressure, are you able to stay focused? Resilience to failure. Does failure discourage you or it gives you the motivation to push on? And second last is self-perception. How do you think of yourself? How do you view yourself? Lastly is emotional control. Are you able to regulate those and handle those unpleasant feelings? So this is the exercise. We have this is the most commonly used tool for assessing resilience. We have 10 questions, and I invite participants to check those boxes. We have 5 options. If the statement is not true at all, you check 0. If the statement is rarely true, check 1. If the statement is sometimes true, check 2. If the statement is often true, check 3. If the statement is true nearly all the time, check 4. So question number 1, are you able to adapt when change occurs, or when changes occur? Check. Just take your pen and check. If it's number 1, say statement 1, your score is 0 or your score is 4 as it applies. Number 2, are you able to deal with whatever comes your way? Again, basing on those scores 0 to 4, check. Thirdly, you try to see the humorous. Are you able to see the humorous side of things when you're faced with problems? Or do you try to see the humorous side of things when you're faced with problems. Score that. Fourth, having to cope with stress makes you stronger. Is it not true, or true all the time, or some of the time, or often, or rarely? Number 5, I tend to bounce back. You tend to bounce back after illness, injury, or other hardships. Check that. 6, you believe you can achieve your goals even when you are having obstacles. Check on that. 7, under pressure, you can stay focused and think clearly. 8, you're not easily discouraged by failure. Then 9, you think of yourself as a strong person when dealing with life challenges and difficulties. Lastly, you're able to handle unpleasant or painful feelings like sadness, fear, or anger. So this is how I will expect us to give the scores. Just type on the section, that chat section. Add the scores. If you scored 0 in all the questions, just write 0. If you scored 4 for the 10 questions, that is 40. If you scored 3, 4, 1, just do the arithmetics and in the section of, okay, wonderful. Keep them coming. Keep them coming. I will give you the interpretation as we move to the next exercise. Wonderful. Because of time, this is the interpretation. The higher the scores you have, the greater the psychological resilience. So that means if you score low, like 0, it means your resilience level is low. Your score is high, close to 40. I don't know how one got 50, because we had 0, 1, 2, 3, and 4. So the maximum score is supposed to be 40. I guess maybe they had scored not true as 1, but we were starting with 0. That makes it the maximum is 40. So that the person who is saying 50, I guess your maximum is 40. You are likely to have scored 4 in all areas. So that is resilience, and how we can just as an exercise see or gauge ourselves where we are. The last exercise on well-being, the well-being index by WHO. We only have 5 questions, and for the past 2 weeks. Of course, the other one was for the past 1 month. I didn't make it clear, but this is for the past 2 weeks. How have you felt cheerful? Have you felt cheerful in good and have been in good spirits? If you have felt cheerful and in good spirits for all the time, your score is 5. At no time, your score is 0. Secondly, have you felt calm and relaxed for the last 2 weeks? 5, 4 to 0. Thirdly, have you felt active and vigorous? Again, the same score line applies. Fourth, for the past 2 weeks, did you wake up feeling fresh and rested? At no time, 0. All of the time, 5. The past 2 weeks again, how was your daily life been? Was it filled with things that interested you? Score 5 and like that. For this case now, we're going to multiply our scores by 20. So if you have scored 5, not 20, it's 4. Multiply by 4. If you have scored 5, it's 25 times 4. We want a range of 0 to 100. If you have scored 0, it is 0 times 4. If you've scored 4 times 5, 20, 20 times 4, 80. Once you do that, post again on the chat box to assess our well-being index. How satisfied are we with life? And of course, you know, under well-being, we have the eudaimonic well-being aspect, you have the hedonic well-being aspect, but generally, this is the subjective state of happiness and contentment. Are you contented with life? How do you rate your quality of life? Let's see on the chat box. If you have scored, all right, thank you. Joe has already posted his scores. Just post your scores as I relate to how we interpret these scores. So just like, thank you. Just like the other scores again, this one, the higher the scores, the higher the well-being status. So if you have 100, a score of 100, that means the best possible quality of life. 0, on the other hand, is the worst possible quality of life. So, and you realize that we have varied scales. We have varied scores from these two scales because of our individuality, and also largely because of how resilient we are, or how we have resources to deal with our stresses. Remember, stress, if you have resources to deal with stress or the demands that come with stress, then you're good. If the demands are more than your resources, then it means stress is really pulling you down. It's draining your resilience energy. So what are the benefits of resilience? We have various benefits, but in the workplace, we will have high employee retention, we'll have innovativeness increased, we'll have decreased burnout, we'll also have high engagement, and you can easily detect vulnerability at the workplace if we have resilience there. At the individual level, resilience will act as a buffer to allow you to cope with your demands that you have and to maintain professional efficacy even as you face the adversity at your workplace. So generally, it will boost your overall well-being, and it will also boost your job satisfaction because you are able to maintain your sense of adaptability and you are able to be safeguarded against burnout. We have 4 types of resilience that we need to have in our workplaces, but in our discussion, we'll focus mostly on mental resilience or psychological resilience. But we have physical resilience, we have social resilience, and we have emotional resilience. Psychological or mental resilience, this is our capacity to deal with or adapt to uncertainty, to deal with difficulties or adversity. This helps us to remain calm in crisis, to remain hopeful in those challenges or threats. Second type is the emotional resilience. This one is how well we can regulate our emotion. Emotional regulation is quite important in dealing with those stressors and in boosting our resilience. Thirdly, physical resilience. How do you take care of yourself? The self-care. This is how your body is able to adapt effectively to the challenges that we face physically, and this also helps us to heal when we have injuries or we have any infection to deal with. The last bit is social resilience, very important. Remember, one of the strategies on building resilience is to have a good social support network. So social resilience, on this other hand, shows how we can deal with the circumstances that which disrupt our day-to-day running as a group, as professionals, the healthcare workers especially. We can say we had a high social resilience during the COVID-19 pandemic. Kenya, we had some terrorist attack sometimes back, and the community there dealt well with that setback. That also applied to America sometimes back when they were when they had been attacked by some terrorists. So the community, not just where you live, but also where you work. How can you deal? The nursing community, the medical community, all those communities under our professionals, our professional cadres. How do we know that you're resilient as a person? What are those characteristics? If you have a good or realistic sense of control over your choices, if you see change as an opportunity or challenge, not a threat, if you are able to pursue your personal goals, if you have patience and strong sense of humor, if you have high level of adaptability, among many other characteristics. But how do you also tell that you need to boost your resilience? How do you tell that your resilience meter is going down? If you are struggling with previously manageable situations, it means that you need to boost your resilience. If you're feeling overwhelmed by normal demands at your workplace, that also means you need to boost your resilience. Again, if your usual strategies are no longer working, it means you need to work out on your resilience. The resilience that you need between 20 and 30, when you're age 20 to 30 years, or age 30 to 40, age 40 to 50, those the demands are different along those age groups. So what was working when you're 20 will not work when you're at 50. That's why we need flexibility. That's why we need to adapt to circumstances and to the demands that we experience. So we have many factors that influence our resilience, right from individual to organizational level. But at the individual level, our personality traits were ranked #1 from the studies, that people with traits such as optimism, openness to experience, sense of purpose had higher resilience. Why? Because people who are optimistic will perceive or will tend to perceive challenges as opportunities for growth, not obstacles. As such, they will have a resilient mindset. Our individual adaptive coping styles also, like problem solving, positive reframing, and seeking social support. Social support is very important. Healthcare workers having these tools are in a position to have higher resilience. Organizational level. Organizations with mentorship programs will foster resilience. Organizations with professional development opportunities, continuous professional development opportunities, and career progression will also have their staff having higher resilience. Organizations which recognize or have initiatives to recognize their staffs and acknowledge them for work well done in various ways, not necessarily monetary ways, but just even some recognition letter of commendation, among other issues, or being given the best staff of the week, the best the nurse of the year, the medical doctor of the year, the psychologist of the year, the social worker of the month, etc. But again, the environment, the working culture, the work culture. How is the work culture there? If we have a toxic work culture, it means it will drain your resilience, and it will mean that you will eventually have lower resilience. If we also have intense workloads and high job demands, it means you can easily have burnout, and you will have exhausted all your resilience resources. Almost doing the last bit of our presentation is the evidence-based strategies for enhancing resilience. Having understood all these, what is resilience, types of resilience, characteristics of resilient people, how do we measure resilience, and now this is the gist of our presentation: strategies to enhance resilience, evidence-based resilience training workshops. This we can consider tonight's presentation is one of those workshops, and this is a proactive approach. The Mofate community and the rest of the team out there who went out of their way to find this topic for tonight and to ask us to reflect on it and also to discuss on it. This is one way to enhance our resilience. So we may not cover stress management entirely, but we'll mention a few bits of it. We also have emotional regulation. We have strategies to cultivate optimism. And all these are aimed at enhancing self-awareness. They are aimed at having deep, coping mechanisms that are effective. We also have to promote resilient mindsets among among the participants, not just here, but also in formal setups where we have these programs. Secondly, we have mindfulness-based interventions. Being present in the present moment, being aware in the present moment, and observing your thoughts without judging, observing your emotions without judging, and experiencing them without being judgmental. That is mindfulness. And this helps us to develop compassionate attitude towards self. We have heard of what we call self-compassion. This mindfulness helps us to achieve self-compassion. It also helps reduce stress, burnout, anxiety, and other symptoms among the healthcare workers. It increases or it enhances our coping skills as well as emotional regulation. So you can do mindful breathing. You have heard of the 4-7-8 breathing. Breathe in for 4 seconds, hold for 7 seconds, release or exhale for 8 seconds. This helps us to be present in the present moment. So the breathing, other practices include 5 senses check. Check on your room, the 5 things you can see. 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. That is grounding. That helps us to be present at that particular moment. You can also scan your body, feel where the tension is, and we have other relaxation techniques that are out there. Apart from the deep breathing exercises, we have the progressive muscle relaxation, among other techniques that have helps us to maintain mindfulness. Thirdly, mentorship and coaching programs. Research has shown that these programs help junior staff in an organization or even peers in an organization to develop resilience. How is that? How does that happen? When you share your experiences, when you share your challenges in the profession, this helps to enhance a sense of professional identity. This helps to enhance or increase self-efficacy, the ability to work out whatever is before you and to achieve your goal, and the ability to do your work competently helps you to also get some resilience. Fourth strategy is what we call stress inoculation training. And this works like vaccines. And of course, in real life, this is done with a lot of caution, so that if you have people who are not able to handle public speaking anxiety, you can train them. Once you have trained them, let them acquire the skills. Once they have acquired the skills, let them apply them in real life. So this is more like psychoeducation, and this also helps to foster positive self-talk. It helps to develop realistic expectations in challenging the situations, because as you do this, you are able to identify and challenge the negative thought patterns that you have as a person. So health professional participating in this program undergo role-playing scenarios. So you can do role-playing before you get to real life situations. But this helps people, because you don't need to wait for you to be stressed so that you can come for a stress training. All of us who may have undergone through some stresses, but there are yet more stresses to come. So once you go through this stress training, it helps you to build coping strategies. It helps you to build mechanisms that are effective and efficient, and as a result, you will be resilient. The last bit is cognitive restructuring. This is very, very important, because how do we appraise our stresses? We have what we call cognitive appraisal of stressors. Or the first thing is, when you have a threat, ask yourself, is this a threat? Okay, if it's no threat, you're good. If it's a threat, ask yourself, do I have the resources to cope? Yes, if you have the resources, you're well and good. If you don't have resources, you need to seek for help, because sometimes you may not see the resources at that time, because as we said, you don't learn to swim when you're drowning. You may not see them. So you need to seek for help. Raise your hand and say, I need help. I need support from the professional, trained mental health professionals. So identify and challenge maladaptive thought patterns that contribute to stress, burnout, and anxiety, and then restructure them. This is an example of how you can reframe. If instead of saying, I always mess up, you can say, I can make mistakes and they are learning opportunities. So see it as a learning
Brother
opportunity.
Nicholas, sorry for
Reframe it.
interruption.
Yes, yes.
Sorry for interruption. I can give you additional 5 minutes to wind up.
Thank you.
All right.
Thank you. Winding up. So I am a failure. You reframe it as, I can face challenges and I'm always learning. I can't do this. You can tell yourself, I'm going to try it. I'm going to try this. I cannot handle this. I am going to try and handle it. So if you tell yourself, I can't handle this, you'll surely not handle it. But if you reframe it, you can easily handle that. So how do we build our resilience? Prioritize self-care, physical resilience, prioritize that. Have some micro breaks at work, have actually adequate sleep, have some balanced diet or nourishing diet. Secondly, develop reframing or mental flexibility. Be flexible. How do you see challenges? Do you see them as threats or opportunities? Thirdly, enhance your emotional regulations. If you don't have a means to regulate your emotions, seek out from the professionals. Practice self-compassion. Use journaling. Use deep breathing. Number 4, build a social support network. Social connection is important, because these are buffers against workplace stress. 5th, establish clear work-life boundaries. You need to have a balance between your work. You need to have a balance between your work and life. So are you able to balance that? You are in course, you're in the right course, developing your resilience. The last one is how you have to identify your purpose. You have to identify your values and connect them to what you're doing daily. When you face a stressor, connect, link that to your values, link that you're not consumed in that moment, but you have a way to cope with that. In conclusion, resilience protects well-being and enables us to thrive, not just to cope, not just to survive. We need to thrive and we need to flourish. So you don't need to endure hardship alone. You have support systems which can help you at your workplace, and the leaders that are here, we need to support our staff. The staff that are here, we also need to support our healthcare organization or institution so that we have resilient institutions, we have resilient individuals. This is our resilience tree. You, at your own free time, you can see how that helps us to develop resilience. So embrace change. Don't be rigid. Be flexible. Be adaptive. And as life gets tough, you also have ways to handle that. So this is my closing remark. You are stronger than you think, braver than you believe, and more resilient than you know. In fact, you can withstand everything except lack of oxygen, probably lack of food or water for some few days. But if you can face anything, your potential to face all those challenges is limitless. And that is our message tonight, that you're more resilient than you know. As a healthcare worker, despite the stressors, despite all these challenges, you have potential to develop your resilience daily. Whatever age you are, you still can learn it. It's something that we can learn, all of us. Thank you, and God bless you.
Thank you so much, Brother Nicholas, for taking us through this important presentation. We really enjoyed it and we learned a lot, considering the fact that healthcare providers face numerous challenges where developing resilience is quite a challenge for most of us. That's why we see even the rating scale. You may find some people have poor resilience depending on the categorization of the rating scale, but we don't know what to do exactly when at a point that we are undergoing a stressful situation. And we really get to understand that this topic is very important for us, especially when we work in high pressure environments with low pay, with long work hours, with understaffing places that you have to work like even double shifting in the ICU and other settings. And then you have a number of stressors from your bosses, from the patients. So a lot of pressure comes from different places. Like you have the family life, you have work life and other activities. So you may find yourself failing to balance those places, that you cannot balance the life issues, the family life, and other even issues that surround you. So you may find the healthcare providers undergoing a very stressful situation, but sometimes the environment is not supportive, the leadership system and other issues. But we understand the importance of the system, the leadership, to be accountable and be able to set the supportive environment, and even strengthening the workplace psychological support to the healthcare providers. So it is now the turn to, the floor is now open, but we firstly need to reflect in like 3 practical questions. Like firstly, which of these stressors are within institutional control? Because we understand the stressors can be from the personal, from the family, from the institution. So what are some of the stressors that are within the institutional control? And second is, what forms of supports are realistic within existing health facilities? Third, how leadership at the facilities level can take responsibilities for staff well-being. not as an extra task, but as a part of the service delivery. Because when we don't consider the staff well-being, the outcome is poor service delivery, poor patient care. So we need to think about what are the institutional support systems that has to be taken in place to be able to, that we achieve the quality of care from the workplace. So I'll now open the floor for reflections and questions. So if you have any questions, any reflections, you can raise your hand and then I can give you the time to speak. Karibuni. I can see one question from Fancy saying, what are the early signs that our mental well-being is declining? So you can use the chat box to write the questions, but if you think you want to speak, I can give you time. But maybe, Brother Nicholas, you can respond to the chat box first question about what are the early signs that our mental well-being is declining? How can someone be able to recognize early that something is wrong with me?
Thank you very much. At workplace, one way we can detect that the mental well-being is declining or deteriorating is how you handle the normal situations. How is your communication? Are you irritable? Are you impatient? Are you lashing out? And how is your relationship with your co-workers? Are you starting to isolate yourself? How is your sleep pattern? Are you starting to lose sleep? Are you starting to are you sleeping more than you need to? How is your nutrition? Are you eating well or you're eating more than you need to? How about coping mechanisms or coping strategies? Are you going for some drink to allow yourself to relax when in the past you could not do that? And many others. Of course, it's specific to particular conditions. If it's anxiety, if you're having burnout, you'll also experience exhaustion. You'll experience fatigue. If it's about depression, you'll start having thoughts of helplessness. Nobody cares about you, and you feel you are hopeless, and many others.
Thank you so much for that insight. So you talked about fatigue. You talked about diminished interest, like someone may start experiencing a loss of interest in the workplace or in the activities that you usually feel meaningful or you enjoy previously. And sometimes you can notice very early, it's more important to think about the functional changes, like the common indicators might include the persistent fatigue that I already discussed, that does not resolve with rest. Reduce the concentration, especially in what you do. You don't really pay much attention on that. Even decision-making capacity and even irritability. You may be easily irritated and having emotional reactivity. So those are some of the issues that have been highlighted. You may start feeling some of the functional changes that you don't have previously. So thank you so much for that. And someone else said, does AI and use, if social media can chat box, so I can give you time to respond in the chat box questions.
Okay, thank you very much. The question I left briefly, so my chat box disappeared. So maybe repeat the question.
So the first question is, does AI intelligence and use media can shape people into resilience, and how this developmental milestone affects and ways to overcome?
Thank you. Use of AI and social media. These are platforms that we have also for psycho-education. So they are quite important, because you may not have sessions like this quite often. So if you're able to read for yourself, whether from books or social media or AI, you pick what is important, because as you pick this, it's not just the head knowledge, it is how you're going to apply. When we talk about mindfulness, it's just the same mindfulness that the AI can give you, but how do you practice that? When we talk about self-care, when we talk about self-compassion, all these ones, these are aspects or elements of psychoeducation that we can get from these medias. So it's very important. Secondly, developmental milestones. As I was saying, in your 30s, 20s, 20 to 30s, your demands are not the same as that of somebody who is at 50. But at 20 to 30, this is the point that you need to develop or establish consistent sleep routines. You don't wait until you are 50 to have a good sleep hygiene. You need to develop that at your 20 or your 30s. Again, at 20s to 30s, you need to develop healthy relationship patterns. You need to build your career stability as early as 20 to 30. If you are at 40 to 50, there are many demands, competing demands, which you also need to manage them. You have family, you have work, you have other responsibilities, including in your community, at your community level. You need to manage this. And how do we manage that? Because we will have busy schedules. At this age, you are climbing the ladder at workplace, in the community, and to know how to prioritize so that you are able to do one later. Which one will come first? Which one will come third? At this point, also, you need to have a strong boundary setting skills. You need to say, no, we'll have many demands. Somebody needs you at workplace to do this. Somebody, you are also needed at you now have some business you're running. You now have other competing demands which you need to balance. Lastly, if you're above 60 now, this you need to buy other things like your physical activities. You are active, physically active at your 20s, but at 60s you need to. This is a point of development that you need to adjust now. Engage socially and get connected socially, because that is when most retiring, and when they retire, they are likely to be isolated if they don't have a strong social support. You also need to find new sources of purpose and meaning, because at this point you have reached your peak of at the peak of your profession. You have now gone to retire, and you don't have any other thing to look forward to in your professional life. Now you need to find other sources of meaning outside professional experiences.
Thank you so much. I can now welcome Mufati admin. I think Brother Moses. I see your hand.
Okay, thank you very much. Good evening once again. So the sessions is very good, and actually I congratulate the presenter. But for me, I have been trying my level best to cite, wherever there is important areas to count in as part of very areas that we have to focus on it, because as world going on, we have a great challenge on that area. The first area that affects resilience and well-being is almost the working environment. So this time around, you can find a lot of workers, they have been stressed regarding the systems that they are interacting each day for their work, but also their bosses, the way they communicate, customer cares, and the other all issues. So I'm just doubting myself, and also keep these questions away. How are we going to modify this kind of working environment, customer care skills at the working place, so that they can shape the resilience and well-being? Because I think this is one of the great areas that have challenges. Thank you very much.
Yes, thank you, Mofate. Maybe I'll respond and also let Claire do some response. At individual level, let's start with the organization. The organizational level, we need to have workshops, training workshops to help workers enhance their mental health well-being. That includes management skills, among other skills that workers need to develop. Secondly is on open door policy, that if staff are able to approach those who are in management, if they have any challenge and the managers are approachable, challenges can easily be overcome. Because if you are able to communicate with your manager, to communicate with your leader in an open manner, without any obstacle, that helps relieve most of the stresses. Because at workplace, if you don't have that is number one source of conflict. So we need to have effective communication, and this communication is two-way, from from top to bottom and bottom to up. And from bottom to up, that comes now to how do we communicate our needs? Are you aggressive? Are you passive? Or are you assertive? The recommendation is that we don't be passive and we don't be aggressive. Rather, we be assertive. So assertiveness is also a skill. It's also a technique that helps us to deal with stresses, that helps us to prevent conflicts erupting into larger issues or bigger issues in our workplace. Kilai.
All right, thank you so much, Nicholas. I'm not really quite far from what Nicholas said about the work environment being one of the, can I say, one of the contributing factor to depressions, the burnout, and the like. So when we talk much about the context, for example, in Tanzania, so we may find like the healthcare providers, the nurses, are underpaid. The workplace environment that we are talking is, we have high patient flow, like a lot of patients, few healthcare providers, high patient to health provider ratios, the task overload that goes beyond the scope, the supervision system, like the long working hours, and also the lack of support or psychosocial support within the clinical areas. So what needs to be done is exactly, the first thing is, if the environment is understaffing, like you may find you have 10 patients in the ICU with one nurse. The challenge arise, the system itself, instead of finding the solution to that particular provider, instead of seeing like, can one nurse handle 10 patients in the ICU, who are all patients are at the life support machine, for example. So we need to ensure that the leadership should be accountable for that critical shortage, for example. So the evidence shows that burnout decreases when the nurse managers and the facility leaders are trained to recognize distress early and are evaluated partly on staff well-being, not only service output. So because we consider mainly the service output without considering the resources that we have, because our facilities are resource constrained, low staff to patient ratio, so the low pay as well. So how can we address those stressors? Because automatically, if you're underpaid, you work like more than 12 hours in a day, you are low paid, you become so much stressed because you have the loss. People who depends on you, the families and the like. So I think these needs for the healthcare system, particularly the leadership, to be accountable, to put the environment that are supportive to the staff. And also, because now we are talking about the workplace psychological support, for example. So can a healthcare provider have a place to seek that support in our settings? You may find there is no any. Are we able to talk and share the situation that we are going through? I can reflect this through one of my experience that I have been working with some of the healthcare providers in Kilimanjaro and Arusha. So we started what we call the beyond the bedside. So what we do is we need the healthcare provider to understand the challenge that we are going through is low pay. We only been trained to take care of patients, but not how can we utilize or monetize our skills. So sometimes I can spend long hours with the patients with low pay, but I have a lot of skills. And then, so someone need to it's not like you leave your career or your job. You continue with your job, but you have the side hustle. You go to the place that there is home-based care. Some clients or patients need you to follow them at home, for example, to do a wound dressing. And then in the wound dressing, someone needs you to do wound dressing for 5,000 Tanzania shillings or 10,000. So can a nurse sustain that life by doing a wound dressing for 5,000 Tanzania shillings? So what is really matter is how can we utilize our skills, our experiences to be able to even to generate income. That income itself is one of the major stressor. Live about the system and the like. So the accountability of the leadership and the like would be one of the major issues to equip or to make the working place to be supportive. That is my view. I can see the hand from Moses.
Okay, thank you very much for a good response. Actually, I've gained a lot of issues concerning with these areas that are more much triggering issues in our working environment. Actually, whenever we are going to put our efforts on how to overcome them, and I think this one will be the best way, because we are the healthcare workers. Actually, we use many hours to be at a working place than even being at home, being at anywhere else. Some of the articles actually even revealing on how we use a lot of hours at work, referring from the article that have been conducted by Professor Tumbwene Mwansisia from Aga Khan University in Dar es Salaam. It is showing that most of hours that we actually use it mostly at workplace. So whenever we found the environments that are very affecting our well-being and also resilience, actually, we are going so much affected in terms of mental health. And I think this is one of the area this is a call upon all healthcare professionals that are investing on mental health. Actually, we have to continue reinforcing and actually placing and also placing the continuous or progressive classes for healthcare workers on how to prevent mental disorders for them because of the work environment current this time around. because even indicate whenever we give our care to the patients and whatever, this one are also the most important areas that we have to focus on it. But I've seen someone else, Gershom Asagile. This one is the psychologist I know, and probably we can hear from him if he can mute mic and speak on this, because I can see this one I've been investing much on mental health at the workplace. Maybe we can share the experience from him. We can hear the experience from him. So thank you very much. This is like a chance we can hear from him.
All right, thank you. I think you can unmute the mic and then speak.
Asajire, karibu. Nimekuona hapa. Okay, so Mr. Kilai, I think this one is out from the phone, so you can continue even taking the moderations as usual. Thank you.
All right, thank you so much. I think I can see Nicholas' hand.
Yes, thank you for that view on perspective that you have shared. And there's something that the associations and the unions can do. Here in Kenya, where we are now is not where we were before 2010 or 2012. But courtesy of agitations for fair remunerations, courtesy of agitation for standard or improved patient to healthcare provider ratios, we are improving. We can see some progress here in our setup, but also we are not continuous agitation and by the association and by the unions, healthcare unions, together with those who are in the health ministry or health organizations, to improve this. So as we do this education, because what high workload does and inflexible hours does to resilience is that it will continually drain you unless something happens. And even as we wait for that something to happen, we have had ideas from our facilitator and not facilitator, our moderator and other guys who are saying you can explore other options to increase your or annual living. There is also need for encouraging all of our colleagues to seek for support. Whenever we feel overwhelmed at our workplaces, let us learn to seek seek for support. Don't fear. If you're feeling you are in distress, you're feeling like you're experiencing burnout, you're exhausted, seek for support, because that helps us to build your stamina. That helps us to build your resilience. Lastly, despite all this, we have what we call locus of control. Where is your locus of control? Is it internal or external? Are you a victim of circumstances, or you can master those circumstances to work for you? Thank you. So I see there's something in my workplace. I know it's not the experience for the whole country, but in my workplace we have what we call employee assistance program. Employee assistance program EAP is meant to help employees going through various challenges, and this includes social and also financial challenges. Apart from work-related stressors or challenges, this program was set up so that employees can be assisted in a holistic manner. So if an employee has issues with the family or has issues handling finances, and also has issued at the workplace, this program was set up to help them in a way. This helps them to build their resilience. This helps them to adapt and to be flexible as they face those challenges, because stressors are constant, but how we respond to them is what is very important. So that is just one aspect at our workplace that was set up to help the employees in that manner.
Thank you so much, Nicholas, for sharing that insight. You can see Michael Dabila. You can unmute your mic and speak. The floor is open for anyone who want to share experience. It's not necessary to have a question, but you can share your insights. I can see Fancy Leonash. You can unmute your mic, please.
Good evening. I'm Fancy.
Good evening.
I work at my teaching and referral. I'm a mental health nurse. Also, to add on what Nicholas has said, I think what healthcare workers need to do is they need to start the change within themselves. So we can't keep complaining about the workplace. There is a lot of overburdening. We are overworked. So there is not enough remuneration. If we are not agitating for our own well-being, no one else will fight for us. So as healthcare workers, we need to fight for our rights first before we start complaining. We need the institution to work for us. We need something to work for us. And also, what we also do at MTRH, we have regular debriefing programs where it's part of our annual performance appraisal. So we undergo debriefing when, especially, I think 3 monthly, quarterly, a year. So where we undergo debriefing, we express our issues, we express what we are going through, and after the sessions, we feel like we have let go of some burden, or we go for team building exercises, especially at the end of the year, where after the program, we feel like some stresses that we are undergoing at workplace are half solved. Another thing I think as healthcare workers need to do is we need to stop the stigmatization of seeking help and professional help, because seeking a psychologist or going for counseling session doesn't harm one person, because sometimes we tend to think that if I go for
I think there's
counseling
network
session,
issue. We missed your point.
What will she think of me, or what will she say, or what will she? Okay, I follow. You missed. Okay, can you hear me right now?
Yeah, now we hear you.
Okay, I was saying that as healthcare workers, we need to stop stigmatization of seeking help or professional help, where we think like, if I go for psychological counseling and the psychologist is my coworker, how will she react, or how will he think of me after that? I think help does not make you less of a person, or does not make you weak. So continuous psychological support from psychologists or healthcare providers can help us also decompress during a stressful moment, and also build our resilience in the workplace. Thank you.
Thank you so much, Fancy Leonash. I like your insight. I have been following through the Kenyan Medical Association on the debriefing session for healthcare providers, and it is quite insightful sessions, and I really like sharing that insight that we can also adapt in our setting. Anyone who want to add on? Mofati? Karibu Moses.
Actually, I have seen Jessica Budegeye was like the hand. I think she has something to say.
Okay, Jessica karibu.
Asante, naombeni mimi niongee Kiswahili jamani.
Alright,
Ongeleni
karibu.
kwa presentation. Nilikuwa najaribu kutafuta namna ya kusaidika. Tumeona one of the way ya mtu kuweza kumaintain na kuovercome hizo challenges ni just sharing. Sasa naona pia changamoto inakuja kwa aina ya watu ambao, yani sometime mtu anaweza kaa na changamoto akashare, na ile the way alivyopata wale watu wa kushare wanakuwa pia sio watu sahihi, inampelekea tena kuendelea kupata shida. Nilitamani tupate ile explanation, yani mtu aone vitu gani kwa mtu ili aweze kushare mambo yake kwa ajili ya kutafuta suluhisho, na yani ni muone nani na kwa namna gani, ili sharing, ili nisije nikashare kwa long person, kwa sababu one of the thing inayoleta shida, you can share your things, lakini kwa mtu ambaye is a long person, na badala ya kusaidika ukaendelea kuingia kwenye changamoto kabisa. Kwa hiyo naomba nisaidiwe maelezo hapo. Asante.
Mr. Kilai,
Yes.
this question is very important.
Safi kabisa. Yeah, I think I can allow pardon?
Yes, for me, I can see this is one of the problem. And I said at a certain point, kwamba at our working place sometime this time around, whenever you have a problem, where to share, who is ready to hear, and sometimes you can have someone maybe we define as a friend or someone else to talk aside, because in terms of mental health as part of the healing, we say if you have a challenge or if you have a problem, you have to find someone to talk. But this time around, we have our fellow friends, our fellow workers. Sometimes you go to share the information, but when you wake up, you see the whole information surrounding all the working environment. So this is one of the challenge. And I think Jessica have been asked the good questions. Probably, Mr. Kilai, based on your experience, you can try to formulate the way of hearing from the others. I think this one is the best question. Thank you.
Thank you so much, Moses. I think what's I can add on that is I can remember some of my colleagues from Kenya say that we need to avoid stigmatization of seeking help. So that's one of the challenges that we have. The issue is you already understand your situation. You notice some of the challenges that you are going through, but you just internalize them. You don't share with whether your colleagues, whether you are your supervisor, whether you are in charge, and anyone. So the challenge might be we don't trust each other. And then you just keep going with until you feel yourself in a point that you cannot even come to the workplace because of a lot of issues. You start having severe burnout that you end up with major depressive disorder. So what we can see is we don't need to worry sharing what we are going through. We don't need to fear seeking help. But the point is, if I work, for example, in Muhimbili Hospital, and then I'm undergoing a certain stressful situation, where can I get help? There's a psychiatric department, there's psychologists, there's mental health nurses, there's psychiatrists, and everyone. And sometimes you can even seek even in the private clinics, because we have issues of stigma surrounding mental health care. Like if I go to the psychiatric clinic, someone see like nimechanganyikiwa na mambo kama haya. So we stigmatize seeking help, and then we may end up in a very serious situation. Welcome anyone else to maybe Nicholas to add on that.
Kweli kabisa ndugu Kilai, kwamba kuna unyanyapaa, what we call stigma, na vile ilivyokuwa kuhusu ukimwi ndivyo ilivyo pia kwa afya ya akili, kwa sababu unapougua ukimwi hutataka mtu yeyote ajue, na wakishajua unaogopa kwamba kila mtu kazini atajua. Lakini kwa sababu kuna mental health professionals wakiwemo psychologists na psychiatrists, psychiatric nurses and all others, you have an opportunity, if you feel you're not safe, to share with your friend, because the levels of friendship also differs. We have casual friends, we have friends who are close to us, we have acquaintances, we also have those who are intimately close to us. So if you are sure you have a close friend you can share with, well and good. But if it's just a casual or acquaintance, just any other friend, you're right to worry on what you're going to share. And if you're going to share, if you must share, be in a position to share something that which it comes out, you will be comfortable to handle. So if you want to share the deep things of your experience, then we advise that we see a mental health professional, because those ones, they are under oath not to divulge, not to share your information with any other person, because that is a therapeutic relationship. This other one, it's just a casual relationship. You don't know how they are going to treat the information you gave and how far they're going to spread it. So there is cause for worry. There is enough reason to worry that this is happening because the people we are sharing with, they are not trained health professionals. So, and unajua watu unajua kuna ile kitu inaweza kuwa you're itching to share after hearing something about Moses or something about Kilai. Your mouth is itching to share with somebody else. Hiyo sasa inakuwa fitina ambayo sasa yule mwenzetu anasema anahofia, na ni ukweli, tuna haki kuhofia ile ambayo tunawaambia. Wale ambao tunawaambia nini, kwa kiwango kipi? Asante.
Asante sana Nicholas. I see many hands. I see Joseph, Joachim. I think nimpe Joachim kwanza, and then afate kuna Samson, Michael, Jessica, Joshua. Hands are many, so nadhani tukaribishe kwa haraka. Joachim, karibu kwanza.
Okay, thank you for the good presentation. I want to share some experience. From this presentation, I have realized that we are like burning candles to give out the light, so patient or client can see the light of the world. So during burning, we pass through the journey of pain, but resilience can help us to withstand the situation and be the part of lighting the way. So thank you very much for this good presentation. But also I have another input on the area of sharing information, and people feel fear of what those information can be used. I can say that sometimes people can use the technique of information to manipulate others purposefully. So we have to choose the right person to share, and maybe the professional one will be the one who is reliable and helpful person to help us in our working environment. Thank you very much on my side. Back to you, Kilai, the moderator.
Thank you so much, Joachim. Now, Joseph Maturi. Joseph, kama unanipata, unmute your mic. Let's Samson maybe anaweza kaongea. Samson, I saw your hands.
Hello.
Yes, Joseph. Kwa kifupi lakini.
Asante sana Mr. Kilas. Nashukuru nimehudhuria, nimejifunza vitu vingi, lakini nimejifunza sana kwenye mtu aliyeuliza, for the one asked the question that who to give your information, when you have something to share. Yani, keeping silence is what kills more. When you have any problem, you have to speak up. That will make you free, and that will give you a room. You have to find someone who is your confidant. You have to trust someone to be your confidant and share it with him or her. That will give you a way, or will pave you a way toward solving the mental health problem. So don't suffer in silence.
Nadhani Joseph amemaliza. So niliona mikono ya
In your
Michael.
working area, but you can share with the others. Example, Moffat traders and others who are mental health specialists who are available. That will help us to move from that risks of mental health. Thank you, sir.
Asante sana Joseph. So now Michael Ndabila, karibu, unmute your mic. Jaribu kuenda maana muda unaenda.
Okay, thank you. I have only one point to add. At workplace, it is better we can replace blame with learning. For example, the mistake should become learning opportunity and not punishment event. Instead of asking, for example, who made this mistake? So instead of doing that, so we can ask what went wrong in this system and how we can prevent it again. So I think this is going to be a normal way of normalizing the situation or reducing the stress at the workplace. So only that I would like to add on that. Thank you for the opportunity.
Thank you so much, Michael. I can see from Neno saying a problem shared is half solved. So now we are still collecting insight from different people, and then we can finalize that. Samson, karibu.
Thank you.
Samson.
Thank you. For what I wish to share is that we have to consider, mental health issues, like the way patients come to the hospital seeking for treatment or management for other health conditions. So mental health issues, when you have mental health issues, you have to seek the right professional. Unlike going to anybody, maybe a friend or a relative who has no ethical ethical conduct, the guidelines that may protect your information. When you go to the professional who has maybe studied that profession on counseling, psychology, they have also their ethics, not sharing the information of the patients. So you choose, take it as other his problems. Kama kuna mtu anaumwa, tuseme malaria, mtaani mtu anaweza akasema dawa ya malaria ni alu, lakini kwa nini mtu anaenda hospitali? Kwa sababu anataka profession ambaye atamwattend, ambaye anajua mambo mengi kuhusu hiyo afya, physical health. Kwa na mental health ni hivyo hivyo, utafute profession ambaye anajua vitu vingi kuhusu masuala ya mental health, lakini pia anaweza akazihandle taarifa zako bila spread kwa mtu mwingine. But tu sisi wenyewe tutakao tutafute namna ya kupata ile kuwa resilience kwenye linapokuja swala la mental health, kusoma vitu mbalimbali, kuattend seminars kama hivi ni njia mojawapo ya kujua kwamba kumbe kuna hichi ninachopitia mimi, hata mtu mwingine anapitia pia. Kwa kumbe siko peke yangu. Kama mpaka mada imewekwa mezani kama hivi, maana yake ni issue ambayo inatukuta watu wengi. Yeah. Thank you.
Thank you so much, Michael. I saw the hand from Joshua, or maybe Enika. Enika, karibu. Enika, unmute your mic. All right. Nicholas Karibu.
I wanted to support and re-emphasize what I think Michael has said. That is quite potent. And we need to repeat that again. And that helps us to destigmatize seeking for help if you have a mental health issue. Thank you very much.
Moses Karibu.
Okay, thank you very much. For me, I can see one of the areas that we can take as one of the positivity to enhance our mental well-being is the issue of changing the problems into solution. Actually, this time around, we see some of the challenges at the working place, and those challenges actually has many contributing factors. And one of the factors that I have been even looking on it is all about ability to change issues into solutions, to change problems into solutions. And sometimes the solutions now have been affected with a number of factors. One of it is exposure. Some of the leaders who leading us, sometimes they miss exposure. They don't have exposure of some issues. So whenever to find the solutions on their problems that are happening on their table, it can become a problem, because they are not exposed to some of the issues. This time around, the world needs exposure. Apart from having a positions, apart from having whenever you have been trusted in a certain office, you have to continue finding the exposure. Exposure sometimes makes ways of solving problems. Sometimes you see some of the problems are not so much loyal. It is like environmental related problems. But you find the leaders are now complicating and putting into difficult environments, so sometimes it's make it difficult. I have been experienced some of the stall. One of our workers got a marriage, and after marriage, it has I don't know what I can say, but the first child and the second child was actually, the interval was very short. That means when you go to lawful environment, you can see that this one has not having the eligibility to get the maternity leave. But because of the conditions, whenever the leader said you have to continue coming to the work, whatever there is, because the law says you are not having a leave. You are not having a maternity leave, the second maternity leave. But that worker just trying to come at work, but it was very stressful because of the environment, because of the health itself. She was not recovered full, but she was attending at work. So you can find it is a problem, because the leader was now likely to use even the normal or the common sense whenever the law says, even by giving few weeks to go home and then to have some recovery, and then to come at work again, finding a normal situation. So for me, I found this is one of the great experience that I've been looking on the leader, because the leader failed to understand the situation that the worker was passing through, and was a nurse, by the way. And I have the one even tried my level best to go and tell the leader that if possible, please, this one is sick, still sick, because she was post-cesarean section. So I said to the leader, just find a way to give the nurse even 1 week or 2 weeks to rest at home to recover first, and then the routine just direct for the other to work on it, because this is one of the way you can save your work. But the problem, the leader was very, very complex, and until the worker now tried to find another way and find another institute, and then asked it to go away from the institute. So she left the work. So this was very hurting problem that I've been experienced myself around the working place. So like I can say here that one of the great problem is some of the leaders, they are not having ability see even the realities. They are still striving to use the law to affect the others. And typical, some of the workers, they are ending up with a burnout and even affected the mental. So I can see some of the incoming years, we can find a lot of mental disorders workers. So for me, nina unga mkono, I can join up someone who said we should change the problem into solution at workplace. This is very important. Thank you. That's the things I wanted to add on it.
Thank you so much, Moses, for sharing that experience. Naomba nimkaribishe Mike, not Michael. I saw Rogers Adrian. Najua tunakimbizana na muda, otherwise this topic haiwezi kuisha leo. So, Karibu, you can unmute your mic, please. From Eliud Kasule, saying, just to say on the ongoing session, one of the very factor predispose us into some difficulties in our working places, especially nurses, is professional communication skills. As a matter of fact, we daily communicate to provide all the services in different level of specialties and working needs. Different level of education and experiences poses an issue of different attitude and perception in our daily activity. Thank you so much, Eliud, for sharing that insight. Anyone mwingine mwenye wazo lolote? Tunakaribia kumaliza session. Judith, karibu. Please unmute your mic.
Hello, Kwanza, I'm grateful for this chance. I'm not really a healthcare professional, if I may use that term, lakini nikiongea sasa, nikiongelesha nyinyi as professional. Kwanza, regarding mental health, what I could request from you guys, being that you are professional, ni nyinyi ndio tunawategemea in the society, for you guys to heal us. So kwanza yafaa muwe healthy before you give us the healthy services we need. So my point is, in our society we are all sick, like everyone ako mgonjwa differently, so we need to be kind to each other, show love to each other. That is the basic thing we can provide, sababu everyone is sick. Kitu cha kwanza chenye unaweza fanya, show someone love and kindness. The chance you get, treat someone kindly, because your mtu ni mgonjwa in a way you don't know. Most of the time when you come to professional settings, saa zingine unapata madaktari wengine wako a bit rude to sisi. Sasa wacha nijiite civilian because nyinyi ni professionals. So if you can treat me in such a manner, inamaanisha hata nyinyi wenyewe hamwezi jitibu. So let's show each other love and kindness, ndio mtu aanze kuheal. Secondly, in the social media tuko na a lot of issues going on, so yafaa tutafute the interesting stories zenye iko positive in life. Unaona saa zile ukipata vitu kama mauaji, those are the things that really degrade our mental health, our mental issues. So let's try and get the positive things in life, and we see everything as a positive chance, every challenge as a positive thing. Alafu when you have a challenge, usingoje mpaka ile wakati aujielewi ndio ujiexplain. Most of the time wanasema someone who speaks a lot anakuwa healed haraka. Kweli utajiexpose, but by exposing yourself, your mental health iko healed in a way that hauwezi jua. Kweli tutasema huyu anapenda kuongea, kusema vitu zake, but that speaking heals you. So let's try and speak out. Usipopata that professional, just look for that friend. I'd rather have a friend mwenye atani expose but nimepona, unaona, rather than nijinyamazie nikisema I'm afraid my stories will be all over the world na nikufe. So that is just nikiongea as a layman's person. Thank you for the chance.
Asante sana Judith, thank you so much kwa kushare experience nzuri. Nadhani muda unaenda sana, tunatakiwa tumalize session saa 3 kamili, na kwa sasa naona kama topic is very interesting, hatuwezi kumaliza leo, hata tukiruhusu maswali hatuwezi kumaliza. So maybe niweze kuruhusu maswali mawili from Daniel Ntamashu na Geshom, and then we can finalize the session because muda umeenda, lakini make sure you use dakika moja tu. Karibu Daniel and then Geshom. Okay, so thank you so much guys for having a wonderful discussion, sharing insight about how this topic is important, especially tulipokuwa tunaongelea kuhusu resilience and well-being for healthcare professionals. The topic is so much interesting. We have identified the stressors, kitu gani kinapelekea hizo changamoto, and what are the tips that we have to do as healthcare providers to build our resilience.
So
okay.
Sorry, I was waiting for Daniel to say something. So that's why I still on silencing.
Aya, sawa, nakupa nafasi ya upendeleo.
Okay, naomba nizungumzie kitu kimoja kwanza kwa sisi watoa huduma, lakini pia kwa waomba huduma, kama ambavyo aliuliza dada mmoja hapo nyuma kidogo. Naomba nizungumzie kuhusu boundaries. Sawa? Kwa sisi waomba huduma tunatakiwa tujue pia kuna boundaries, kwamba kuna kitu ambacho anaweza kaongea na mtu fulani, lakini yule mtu hana ile professional ya kufanyaje, ya kutunza nini, ya kutunza kile ambacho anachoenda kufanyaje, kumwambia. Umeona? Na nadhani kwa saizi imekuwa kwamba inawezekana kila mtu anajiona kama ni nani, ni mental health practitioner, as long as yupo katika nini, katika department ya nini, ya health. Umeona? Kwa hiyo kiuhalisia ni kwamba sio kila mfanyakazi wa afya anaweza akakusaidia kwa upande wa mambo ya nini, ya mental health. Kuna watu hawajui mambo ya empathy, kuna watu hawajui mambo ya confidentiality, hawajui mambo ya privacy. So once unapopeleka shida yako, sawa, hawachukulii uzito kama ambavyo watachukulia uzito wale watu ambao wamefundishwa tangu muda mrefu kwamba kuna kitu kinaitwa empathy, kuna kitu kinaitwa confidentiality, kuna kitu kinaitwa privacy. Kwa hiyo tuna mipaka kwamba okay, ninachoenda kumwambia mtu, nikienda kumwambia yule mtu ambaye sio mfanyakazi au sio mtaalamu wa hicho kitu, je, anafahamu mipaka ya kile kitu ninachoenda kumwambia kwamba atakitoa au hatakitoa? Kwa sababu madhara yake hayatokuja kuwa kama vile professional ambavyo umemfuata mtu ambaye ni professional kwamba anajua mipaka yake ni ipi, kwa hata kikosea atakiwa kuwajibika. Lakini la pili, kwa sisi watu wa huduma sasa, nasi pia takiwa tuwe na nini, tuwe na mipaka kwamba okay, mimi ni nani, mimi ni daktari, lakini as a doctor mipaka yangu ni ipi? Of course nimetambua mtu ana depression, si ndio? Nimetambua huyu mtu ana stress. Je, ninaweza kweli kumanage stress mimi kama mimi? Au mimi kama mimi naweza katoa antidepressant labda, ila kuhusu counseling I'm not better kwenye counseling. Umeona? Kwa hiyo natakiwa hata sisi tunaotoa huduma tutambue mipaka yetu kwamba okay, mimi ni daktari, nitaishia kwenye udaktari, ikifika kwenye issue ya counseling nitarifaa kwenda kwenye nini, counseling department au kwa psychologist. Umeona? Kwa hiyo kwenye mipaka naomba nieleweke namna hiyo, kwa sababu ya muda pia naomba niishie hapo. Asante.
Thank you so much Yeshom. Naomba sasa nichukue nafasi hii kumkaribisha the president of Mofate platform aweze for closing remark. Najua muda umeenda na tulikuwa tumetarajia session ishe saa 3 kamili, so tumezidisha dakika. Karibu Moses for a closing remark.
Thank you very much. Thank you very much, Chief. Actually, we have huge issues to discuss on this topic. But because of time, we are so much limited ourselves so that we can allow others to go and rest because tomorrow is a church day. So maybe I will take this opportunity to first appreciate all the activities that have been done by presenter. The facilitation was very unique, very constructive, and very directive to us. It has a lot of tools to work on it. We have seen some of the questions that have been highlighted there as part of evaluating our status, and so that we can find a way to deal with them and to control the resilience and well-being. And also, we have seen a good modelation that have been done by Kielai Kalino, our specialist in mental health. Actually, the investment is good for us and have been tried to focus on the issues that are very useful and very functioning to us. So thank you very much for your modelation. But also most appreciations goes to all participants, specifically Mofate team for the preparations, my fellow leaders. But also the appreciations goes directed to all participants, the psychologists attended here and the other healthcare professionals, including nurses and midwives, doctors who were here with us today. So your participations actually have shown us invaluable contributions and insightful that we have been listened and we have been gained from you. So these sessions was actually the first sessions for 2026 from Mofate. And this one was the opening sound for 2026 digital learning. So we have a different series of sessions that are coming, and we would like to take a chance to welcome you again for the next sessions that we are going to invite you. And actually within Mofate, we have the mental health course. So this mental health course, we are trying our level best to shape that will also goes direct to reflect on the realities on the places that we are working, and also much reflections to workers, because we are the one who have been affecting much on these areas because of the challenges and the world changing and emerging conditions and diseases currently. So my final appreciations should go to all participants coming from away from Tanzania, including those from Kenya. We have seen your contributions and your presence. Actually, we value and we appreciate and we welcome you again for the next sessions. And finally, I would like to take a chance to say that Mofate is here to support the healthcare professionals by engaging into different insightful discussions and sessions that are coming also. So don't hesitate to communicate with Mofate if you have a good issues that you have to share with the healthcare professionals. We can blend, and so we'll reach all over the area that you want. This is very important because this is the technology that we use. So finally, I would like to conclude that these sessions of today have been highlighted live at our YouTube channel. So everyone can hear from there, and these sessions will live. So the link will be shared all the times. So if you want even others to continue hearing what you have been discussing today, you'll share the link of with them so that they can take a fall if they missed it today. But also all the dialogue, all the messages and all the issues that have been happening today have already stored in our customized Google platform that we are using today. So everything has been recorded. So attendance and everything. So for those who need to get CPD points, remember to contact Mofate so that we can prepare the summary of CPD. And also you can continue taking a chance to follow the other sessions. And then finally, you'll have a summary of CPD of the year. And then if you find or you go to get the CPD or to renew the license, will help you because Mofate has been recognized by the Tanzania Nursing and Midwifery Council and also the Ministry of Health for this digital learning as part of the CPD providing agents in Tanzania this time around. Baada ya kusema hayo machache, naomba tuendelee kuungana na presenter wetu na facilitator wetu katika njia mbalimbali. Tutakuwa nao kama kuna maswali, kuna vitu ambavyo pengine haujapata response leo vizuri, tutaendelea kutoa response za haya maeneo kwa kuungana pamoja na facilitator pamoja na moderators wa leo. Basi naomba niwashukuru sana na niwaombe samahani kwa kuvuta dakika 5 kwa ajili ya kufinalize. Otherwise niwatakie kila laheri. Tutakutana katika vipindi ambavyo vitakuwa published na vitakuwa blended the other time around. Thank you very much and have a good night all of you. Nakushukuru sana Nicholas B, tukutakie kila laheri na usiku mwema. Wasalimie sana Kenya. Kaka Kilaya,
Shukran.
thank you very much. Have a greetings and pass our greetings to Kilimanjaro there. Thank you very much.
Asanteni sana wote na karibuni wakati mwingine.
Thank you very much. See you all. See you all. Let us have a rest for chatting tomorrow. Asanteni sana.
Thank you.